We'll go straight to with the COVID update. Don't go away. So, face, space, and fresh air. That's the advice. Good morning, Dr. Seshni, and welcome to HIV Breakfast and to the COVID update. How are you doing this morning?
Good morning, Apoku. I want to say I'm well, but I'm not. And your message just said it all, because you must have realized how I've been feeling. And, you said that you're feeling quite bad for the people in India, and I feel the same. I was up at 4 this morning looking at the news, did the same thing last night, and in tears, because it's really, really so sad to see. It's sad to see, it's sad to hear, it's sad to speak to our friends and family, and also because it's very close to home. We've got a lot of friends and family in India, and I spoke to a close colleague of mine here in the UK, and his mum and dad both tested positive. They in Delhi, and the mom's still in hospital, but hopefully she's going to be fine. But and they've lost distant relatives, so it's really hitting very close to home. And we know the parents; we've known them for years, for over 20 years. So it's upsetting to know what's going on.
I had to stop myself from watching the news last night.
Yeah.
Because I was getting upset, and I was seeing all these people, I'm beautiful human beings, just some of them just dying and cannot get help.
Yeah.
Not because people didn't want to give them help. It's just that people were helpless themselves.
Yeah.
And I was watching this, and I had to stop myself from watching it because I was getting emotional. And I thought, I was wondering how you would be feeling, especially because you've got relatives in India, and it's just sad, really, really sad. All we can do now is to give them our help and our prayer. We pray that everything's going to be fine in India. Things are going to get better.
Well, that's what I was when I remembered what you said. We just need to be optimistic that things are going to get better. It is going to be a rough few weeks. We're going to see more of it. It's increasing exponentially. We've only seen the beginning of what's happening in India, and we've seen the numbers. I think it was over 3,580 deaths yesterday, and that's not accurate numbers, not accurate figures, and over 380,000 infections. So the death toll's gone to over 204,000, but I suspect it's much more. We have to be optimistic. We will. I mean, everyone is praying for India. Our thoughts and prayers with India. I think what really hit me was Arundhati Roy. She's a famous author, and she said what's happening in India is like a crime against humanity. And criticizing the government. I mean, I don't want to go into a blame situation. It's not for us to decide. I think at this moment in time, it's more important about praying for India and hoping that they get the supplies, the treatment, and that the infections go down, and they get the vaccines if they need that. So whatever they need to be getting it, and I think that's the main focus at this moment in time.
Yeah, but what I don't understand is the fact that people in India, especially in the Indian state of West Bengal, are voting in the final phase of elections despite the rising caseload. We all know that. The news says that there are long queues were seen outside polling booths, raising concerns about further spread of COVID amidst a deadly second wave sweeping the country.
Yeah.
The experts are saying already fear that West Bengal could be the next epicenter of the virus, given the fact that campaigning has continued there with large crowds. Why do they keep doing this?
Well, this is surprising, because this is what one of the contributors is all these large events and gatherings and having the elections, and Narendra Modi was also part of these rallies earlier on in the month, and this has definitely contributed to the spread of the COVID-19. That, in addition to the Kumela, is a 2-month festival, which there was about 3 million people that were in the River Ganges and in that festival over the 2-month period. So this, the Shivaratri, the riots of the farmers, all of these have contributed to the spread of COVID-19. So I'm so uncertain. I mean, because there's lockdown.
I would have thought that they would just say, okay, you know what? Let's try and solve this problem. Let's try and bring the infection down. And then we can have elections later. Why are they still allowing people to have, rallies and, the voting and all that? It's not good at all,
No, it isn't. It's really concerning that they continue with the rallies, continue with the big gatherings, and this is how it's spreading. Because yes, and as I was telling you, I was watching a video by Prof. Sridhar, and she's a scientist in Edinburgh, and she was saying that she was in India today, and she was saying that the way in which, as I said, the way in which the virus mutates is because there's infection is spreading. So the more and more the infection spreads, the more and more the numbers go up. That's giving the virus a chance to mutate. So that's why it's double mutated and triple mutated. So this is where we've seen, this is why India is in such a bad situation, is because obviously of the transmission, the rate of transmission, and also the numbers increasing, and therefore it's mutated. And because it's mutated, it's now created a virus which has affected the population, and they're seeing young people. That's the reports that I'm hearing and that I've heard firsthand. Young people, 20, 30 younger people getting serious infections and dying. So it's not just our elderly populations or the ones with risk factors. So this is now the concern. So India is in the midst of the pandemic. It's in a crisis situation. There's a shortage of beds, shortage of medication, shortage of oxygen, and also they are dealing with a triple or double mutant. And also there's only 1% of the population has been vaccinated. We know that the rest of the world is giving aid to India. UK has given them supplies, medical supplies and oxygen. President Biden has offered to send vaccines, but I'm not sure when that's going to be released because that hasn't been authorized yet. And as you said, France has also been giving aid. It is a really a situation where I think the whole world needs to come together, and we all need to just think about how we can help India in whatever way we can. And we're just praying for people in India. Like you said, it's so surprising why the elections are still going on, why people are going and voting. I think maybe they're misinformed. That's what I was told. I was informed by some people in India that some of the information going around is incorrect. So I think what has happened is that people thought that people became complacent because India did so well in the first half of the pandemic, and because they felt that they had it under control, which is fair to say. But I think because of that, they became so complacent that they just continued to go about their normal lives, and then obviously had these large gatherings. So the government has been criticized, Narendra Modi and the government officials. But hopefully now with lockdown, with supplies and with the vaccines, that we're hoping that things will get better. And we have to be optimistic, yeah.
We continue to pray. Right?
Yeah.
Let's go to, before we come to the United Kingdom, there's not much news on COVID in the UK except for some vaccine news. But first of all, before we do that, let's go to Brazil, because Brazil is also a concern.
Yes.
It's a huge concern. And Brazil's Congress has launched an inquiry into the government handling of the pandemic, the coronavirus pandemic. And they have seen more than 14 million cases and 391,000 deaths since the pandemic. But the inquiry could potentially lead to the impeachment of President Jair Bolsonaro, who has frequently spoken out against lockdowns, masks, and vaccination. But he says he's not worried by the inquiry.
Yeah.
What's going on with this man, and what's going on with this? He doesn't seem to care about, I might be wrong, care about the Brazilian people at all. He's talking about economics, and he's talking about money and everything, and he's saying he's rubbishing or he's downplaying. Rubbishing is a bit too much, but downplaying the pandemic and the way it's killing people in Brazil. And now they're going to, open. They're going to have an inquiry open against the government, and he's saying that he doesn't care.
Well,
this is not worried about the inquiry.
I'm not surprised by his reaction. I'm sure you're not surprised.
He's caught coronavirus, hasn't he?
Yeah, he did. And I'm not surprised by his reaction. So Jair Bolsonaro has definitely surprised us during this whole pandemic with obviously not acting in the way he should be as the president of Brazil. And he's been criticized from the beginning of the pandemic. We know that Brazil is obviously is number 3 in the list, and so India surpassed Brazil, but they still have higher number of deaths. And we know that actually the Brazilian variant is quite worrying because younger people are getting infected. So it's more younger people that are getting infected and dying, and it's spreading faster. So a lot like what's happening in India. So it is concerning that obviously, but not surprising, that Jair Bolsonaro has said that he's not concerned about the inquiry into his management of the COVID-19. And I think that just shows the insight, and it's worrying, to be honest. It is worrying and concerning, not just for the world, but for the people of Brazil, because, here's a leader that obviously is not willing to recognize if he's made a mistake. And we can use UK as an example, because early on in the pandemic, they were criticized of not implementing lockdown very early on, and in the way lack of PPE and so many other factors. But later on, we saw that in the second wave and in the second and third lockdown, UK has done everything to ensure that they were keeping the numbers down. And we've seen proof of that. But obviously, here's someone in Brazil, president, that does not want to recognize it. And it's concerning. So it's very similar to what's happening in India, because even in India, the Prime Minister, Narendra Modi, and the government officials are rather wanting to keep everything under the, under wraps, and no one get to the bottom of what's going on. And this is exactly what Jair Bolsonaro is doing. He doesn't want to be exposed, because he knows that if they are going to do the inquiry, what they are going to find out. So let's see what the inquiry finds out, and let's see how he's going to react with the findings, because definitely there will be findings that there was insufficiencies, and there's a huge criticism on the way he's handled the pandemic.
For me, the difference between Jair Bolsonaro and Narendra Modi is the fact that at least Narendra Modi appears to care.
Yeah.
He appears to care. Whether he cares or not, we don't know for a fact. But I believe that, he appears to care. But Jair Bolsonaro, he says it blatantly.
Yeah.
He actually tells the people of Brazil, grow up, man. Stop
yes.
whining and stuff like that.
Exactly. I remember he said, stop whining. Yeah, he said,
to tell people who are dying constantly, telling them, grow up, man, and stop whining. Death is not whining, mate. Death is death, and human beings, you're losing human beings, precious human beings.
Yeah.
It gets a bit to me when I hear the sort of things that he says.
I can see.
Yeah, and especially knowing that he contracted COVID-19. Anyway.
No, I can see you're upset, and it is really upsetting. Because especially if people depend on the leaders, we depend on our leaders, we depend on the WHO, the World Health Organization, the UN, and all these other big organizations. And I think if we have leaders that are going around getting the virus and then obviously not even taking precautions and not admitting, we have to admit and we have to reflect. This is like with India, and look with UK, as I said, UK is an example where we've tried to overcome our difficulties and where what went wrong. So the government definitely has worked hard. US, they're also trying very hard with the new president, Joe Biden and Kamala Harris, and but obviously in India as well, and Brazil, clear examples where the leaders are definitely not doing their best, and it's sad because people are losing their lives.
In the UK, for example, when, like, as you said earlier on, when the whole thing started, the government was criticized for not taking action, on time, and lack of PPEs and all that. But kudos to the government; they rose to the occasion. They did, and they're still doing what. And look at our numbers are dropping.
Yeah.
And things are getting better in the United Kingdom. Now the economy is open. The economy suffered. Now the economy is open. People are much more confident. People can go out and shop and still keep, to the rules and So UK is a shining star when it comes to controlling the coronavirus, and also like a lot of other countries, even poorer countries, way poorer countries than Brazil, people have stood, they've put their foot down, they're doing stuff, and the numbers are coming down.
Yeah.
It gets to me that when I think about this man, telling his people to grow up.
I think for me, that is a very upsetting, and also, like I said, it's so worrying and concerning if the leader says things like this, and that's not for me. That's not. I mean, that is one part of it, but the main part of it for me is these people depend on you and on your guidance and your leadership, and the government controls so many things, the health system and everything, and we know how important the government is, and then the most concerning thing for me is that people are losing their lives. This is what it boils down to, like the situation in Brazil and in India. India, the government has failed them. I've always held Narendra Modi in such high esteem, and I've been very fond of him, but I'm truly disappointed. And so much so that I'm so upset with the way it's been handled. And the situation, I mean, if you listen to the videos and the news, the people are saying that they feel like they've been let down by their government. And it's so upsetting because people are losing their loved ones. They're not even getting a chance to grieve a pogo. They're having to just see their loved ones die within minutes of getting unwell, or hours, having to travel hours to get oxygen, then go to the crematoriums and wait up to 20 hours, if not more, to burn their bodies and cremate them and give them their final rites. And then even some of them are having an undignified funeral where they're just being burned on the side of the roads. So it's, and figures, I mean, I read an article where they're saying that, in the one article I read the day before was, they said Delhi had about 380 deaths. But someone who deals with the crematorium and the last rites said that that's incorrect, because he's picking at least he knows in the context that he's got, in one area they're picking at least 1,000 bodies. So if that's the figure that we are here seeing on in the news, and that's just figures from hospitals, what about all the other people that are dying? And I think what's now concerning is that it's moved from the bigger cities like Mumbai, Delhi, Maharashtra, Lucknow, all these big cities, Calcutta, Punjab, all these places, it's now moved from these big cities into the smaller towns. And this is where we were concerned that obviously when it moves to the smaller towns, that it's going to obviously be much worse. And I think I went through an article which this morning at 4, which had all the different states and going through each of them and what's happening. And I think Goa for me was a surprise, not a surprise, but Goa went into lockdown yesterday. Delhi's in lockdown for another week. So a lot of the places have implemented lockdown, which they should have done a long time ago. I think this is what should have happened And yeah, so Goa as well. I read an article where there's some people from the UK that stuck in India, and one of them is in Goa, and he was saying that he's seeing young people in their 20s and 30s getting unwell. And Ferdinand, they've got family in Goa. His brother's wife is married to a lady from Goa. So yesterday we were just trying to find out how things were in Goa. So
Anyway, let's move away from it,
yeah,
before we all get very emotional and upset.
I know. Sorry to bring it up again, but
No,
yeah, I thought I was going to be in tears talking about it because, yeah, it is so emotional. I know the feeling.
Let's come to the United Kingdom. We've got a bit of good news here. An extra 60 million doses of the Pfizer BioNTech COVID vaccine have been ordered by the government as it puts together plans for a vaccination booster program in the autumn. We were told that the government or the UK is running out of vaccines, and due to delays in production and all that. But this is good news to hear.
Yeah.
This, they've ordered an extra 60 million doses of the Pfizer vaccine. It brings the total number of the Pfizer doses ordered by the UK to 100 million. That's cool. The expectation is that the most vulnerable groups will be offered another jab before next winter, which is really, really good news. Now, nearly 2/3 of UK adults have received one dose of the COVID vaccine, with a quarter having had two. So, yeah, the health secretary, in a briefing of the booster program, would keep us safe and free here while we get this disease under control across the world. That sounds like a good idea. That's some good news.
Yes, that is obviously good news, especially that we're getting, further 60 million doses of the Pfizer and BioNTech vaccine. So I think UK has been doing very well with the rollout of the vaccine, and hopefully they are planning ahead as well, because we don't know, because there was a third and a fourth wave predicted sometime May, June. We know that lockdown measures are going to ease further in terms of travels from the 17th of May. So I think it's really important that obviously we get sufficient vaccines. I did read yesterday as well, and I don't know whether you were aware of it as well, but the NHS passport is going to come into effect. Yeah, so that's what I read about the NHS passport. And there's going to be an app where, so I think in terms of the vaccine, so the NSA app to be used as coronavirus passport for international travel. So that was the news yesterday. I think after we had done the show, I saw this news. So
how's that going to work? Can you read it out to us?
Yeah.
Let's get in front of you.
Yes, I do. So from the Sky News, they said NHS app to be used as coronavirus passport for international travel. Grant Shapps has confirmed. So Transport Secretary told Sky News that he will set out soon the details of the countries which have made it on the green list. So Britons will find out which countries will be able to enjoy quarantine-free travel this summer in the next couple of weeks, as the Transport Secretary confirmed an NHS app will be used as a COVID passport for travel abroad. So under Prime Minister Boris Johnson's roadmap for lifting lockdown restrictions, international travel without one of the current exemptions, which exclude holidays, will not be allowed any earlier than 17th of May. And they have set out plans for a traffic light system to be used to categorize the different destinations, as we knew. And so obviously we'll have to wait and see these destinations where Britons will be able to travel without having to quarantine on their return, although they will still need to undergo a COVID test before their departure, as well as on the return to the UK. So the NHS app will be used to allow Britons to demonstrate whether they've had the COVID jab or tested negative for the virus before traveling abroad.
Okay.
Yeah.
So everything's going to work. It's going to be on the app.
On the app. So you'll have to download the app, and obviously we're still going to get some more news on that.
Is it the same? It's not the same app as the track and trace. It's
No, no.
Okay, so that's
No.
different.
So this is going to be a COVID passport. So it's very different. It's going to be it's basically the COVID certification or COVID passport where people will have to show that they've had the vaccine or that you've been had the testing. So yeah. So in order to travel.
I wonder how that's going to work out. Because we know we've got the, I have my first jab and I've got the card.
Yes.
I've got the card that shows that I have had the jab. I was actually wondering what was going to happen if I got the second one. Are they going to put it on the same card, or? But now that we're talking the app, I believe that some sort of information will be input into the
yes.
Will put into the app. Anyway, yeah. Well,
yes, I think with the NHS app. So like when we go to the doctors, we all have our date of birth and we have our hospital number and we have an NHS number. So when you download the app, you will probably have that same key number. You will have to put your details in, which obviously then will be connected to the system where you've already, which will say when you've had your vaccine or whether you're going to have to input that. And you're testing, you might need to upload your results or they will connect the results wherever you've had it. So it will be an app like that, which obviously we knew that this was coming. We knew that this was a possibility. And so it's not a surprise. And I'm not surprised that it's going to happen quite soon. But maybe whilst we're waiting for the app to fully be launched, it might be a fact that you might need to show the testing, like how people have been showing their testing with the results, the paper results, or with your card saying that you've had the vaccine if you need to travel. But obviously, this is we'll know in a few weeks more about what's happening. But I think it's really good that they're actually planning people, so that now people are already informed that if you do want to travel, you need to have your testing done, which we knew, and you need to.
Sorry, I just got a text from someone who's listening, and she's saying that I've had my second jab earlier this month, and they used that same
card. Yes.
They put his details on.
Yeah.
Thanks for informing us.
Yeah, thank you for confirming that. I thought as much they were using the same card because obviously you need that to show proof, and obviously that will have all your information. Thank you for that.
Yeah, that's amazing.
Yeah.
Anyway, should we just do the numbers?
Yes, I think so. We've only got 4 minutes, and we've just spoken mostly about India, which is a huge concern still at this moment in time. But yeah, 150,256,878 global cases as of today, the 29th of April 2021, on the Worldometer. Number of deaths are 3,164,577. Total recovered is 127,795,715. And in USA, number one with 32,983,695 positive cases with 588,337 deaths. India, number two with 18,376,524 with 204,832. But as I said earlier, numerous reports saying that those figures are not accurate. Brazil is 14,523,807 with 398,343 deaths. France number 4 with 5,565,852 positive cases with 103,918 deaths. Russia number 5 with 4,787,273 positive cases with 109,367 deaths. UK number 7 with 4,411,797 positive cases with 127,480. And South Africa number 20.
Number 20 is going down now, isn't it?
Yes, it is. But I'm still hearing people are getting infected. So it's still there, but the numbers are still staying quite low. So 1,578,450 positive cases with 54,285 deaths. And we've got Ghana.
It's gone down, so I've gone to number 93.
Yeah, Ghana is 93 with 92,513 with 779 deaths. And China's just caught my eye because neighboring with India. So China's number 95 with 90,642 and 4,000.
I don't know how the Chinese do it, to be
Yeah, I
honest.
know.
I don't know how to do it, yeah.
And 4,636 deaths. So they've stayed quite low, isn't it? And before we go to the UK figures, I just wanted to say that the India variant has been found in 3 people in Leicester, so there is still a concern. So I think we people need to still adhere to the public measure guidance because the Indian variant has been found in the UK. So 3 cases in Leicester and quite a lot of other cases around the country. So I would say that we need to be careful. So in terms of the number of cases in the UK in the last 24 hours, it's 2,166 with positive cases with 29 new deaths, and every life matters. Thank you so much, Apoko. It's always been great to be on the show with you, and hopefully I can chat to you tomorrow and we can have more update about India. I hope things will get better in India. We're praying for them. And yes, our heart goes out to the people in India. And whatever we can do to help, I hope we will. If people want to help and reach out, they will be able to do that in whatever way or form. Whether it's just support, listening to your friends and family that have relatives in India, or just checking up on people, and offering your services or volunteering. I think any form of help in India is going to help them, and we all need to be in this together so that India can pull through. Because I think Dr. Fauci said, and someone else, the headlines were that whatever's happening in India is going to affect the whole world. It's not just
That's a definite.
it's not just affecting. Yeah, it's not just going to affect India. It's affecting the whole world. So yeah. So I think we need to remember that.
See you tomorrow and have a fantastic day.
Yeah. So yeah, have a lovely day and stay safe wherever you are, and lots of love to your family. And namaste. Bye. Thank you so much, everyone, for joining the Hospital Radio Bedford. And namaste, guys. Stay safe wherever you are. Lots of love. Bye.